The NADC will be the apex body for addressing drug use prevention and drug control issues in Mauritius. It contains 28 sections and englobes almost everything that Mauritius needs to be able to look forward and leave a legacy for the generation to come. Madam Speaker, the NADC will be administered and managed by the Drug Control Board, comprising of a chairperson and at least 20 members, including representatives from different ministries, the Commissioner of Police, the Commissioner of Prison, Secretary General of the National Social Inclusion Foundation, and members from the civil society, having the responsibility to make policy decisions. Madam Speaker, the board may set up such committees as deemed necessary to assist it in the discharge of its function in the fight against drug abuse. There will be a committee for each division, such as Policy, Research and Strategy Division, a Treatment and Rehabilitation Services Division, a Prevention and Public Awareness Division, an HIV/AIDS Prevention and Care Control Division, and a Supply Reduction Coordination Division. There will also be a Chief Executive Officer who will be the head of NADC and will be responsible for the control and management of the day-to-day business and operation of the NADC. Madam Speaker, this inclusive approach, where all stakeholders will join hands together, will no doubt fulfill the very purpose of the NADC. It will be a golden opportunity and a unique chance to rethink the drug policy and repair the damages caused by the previous government. Madam Speaker, the NADC will no doubt find solutions for the victim of substance abuse. They should not be looked as only victims, but they should be considered as patients suffering from a form of sickness and whose place are not certainly in prison, but in rehabilitation centers and have to be taken care by health specialists. Madam Speaker, the dispensing of methadone at local police stations, as per the methadone program, has to be revisited again. Many of the victims are often left by themselves, abandoned by the family, and do not receive proper psychosocial help and support to get out of the drug web. I have no doubt that the NADC will come with the appropriate solutions for the victims. Madam Speaker, every board will have to take oath before assuming functioning according to Section 23, and they have to maintain the confidentiality any matter according to Section 24. Section 25 also gives protection to whistleblowers, and there are severe penalties if there are victimization or retaliation. All safeguards are present for the NADC to work perfectly. Madam Speaker, Section 27 amends the Dangerous Drugs Act and gives the NADC powers to rehabilitate victims where the offender is willing to undergo therapy to overcome his addictive behaviors to drug. This as well will enable the NADC to play a pivotal role in the fight against drug abuse. Madam Speaker, the war on drugs abuse will not be easy. Once the NADC has been set up, being at the apex and deciding on policy decisions, we are sure that representation will be made to evaluate the debate in relation to cannabis. Madam Speaker, it will be for the NADC to decide whether to prevent the deadly, uncontrollable proliferation of synthetic drug. Cannabis use will be seen the way forward or not. There has always been a raging debate between legalization versus decriminalization, recreational and its use for medical purposes. Madam Speaker, the NADC, we hope, will be able to draw the line and come with the right policy decision. The NADC will have to refer to the best practices in various countries and come up with the best solution in our fight against drug abuse. Madam Speaker, everyone should join forces together in the pursuit of the common purpose to have a healthier society with less crimes linked to drug abuse and protection of the vulnerable. A healthy society rests on three fundamental pillars: the government, the private sector, and the civil society, where each has a distinct role to play. It is also crucial to ensure that there is a healthy population capable of contributing to the sustainable economic development and growth of the country. This will be possible through education, poverty alleviation, the bonding of family values, and a change in the perception of the people. Madam Speaker, the NADC will no doubt be the laying foundations where the collaborations of the public and all the stakeholders, including the law enforcement agencies, will enable the nation to move forward with a clear collaborative goal for the nation's future. I thank again the Honorable Prime Minister and the Deputy Prime Minister for bringing in this bill. Thank you.
Thank you. Thank you for keeping the time, Mr. Babulal. Mr. Kira.
Madame la Présidente, nous débattons en ce moment d'un projet de loi crucial, le National Agency for Drug Control Bill. Un texte de loi tant attendu car le pays est actuellement en état d'urgence sur le sujet de la drogue. Au risque de me répéter, la situation dans le pays aujourd'hui est telle que les bonnes intentions contenues dans le projet de loi ne suffisent pas. La société devrait aussi avoir son mot à dire. De nombreuses ONG militent pour que Maurice emboîte le pas à des pays développés qui ont assoupli leurs lois sur la consommation du cannabis. Une question que je me pose, Madame la Présidente, est-ce qu'un projet en faveur de la dépénalisation du cannabis aidera à combattre la dangereuse montée des drogues de synthèse et anéantir ses effets désastreux sur notre société? De nombreux experts en sont convaincus. Certains parlent même de légaliser le cannabis. À un moment où nous sommes en train de repenser nos manières de lutter contre la drogue et de faire plus d'efforts pour la prévention et la réhabilitation, il ne faut pas laisser nos réflexes passéistes nous empêcher de prendre des décisions courageuses. Qu'en pense le gouvernement? Madame la Présidente, je réitère ma demande au gouvernement pour lancer un débat national et d'organiser, si besoin est, un référendum sur la dépénalisation du cannabis. Je suis d'avis, Madame la Présidente, que le National Agency for Drug Control Bill devrait faire provision pour la décriminalisation des drogues ou, s'il y a consensus, la dépénalisation du cannabis. Ce projet de loi met uniquement l'accent sur la réduction de la demande, la prévention, la réhabilitation et la réduction des risques. L'absence de mention de la décriminalisation ou de la dépénalisation peut être interprétée comme une volonté de maintenir une approche répressive malgré les débats internationaux sur les bienfaits des politiques plus progressistes, comme celle, par exemple, du Portugal ou de certains États américains. Certains experts estiment qu'appliquer une politique répressive sur les consommateurs de drogue peut entraîner leur accès aux soins, peut entraver, leur accès aux soins et à la réinsertion sociale. Il faut aussi, Madame la Présidente, revoir le programme de la distribution de la méthadone, qui, de toute évidence, n'apporte pas les résultats voulus. La méthadone, qui est à la base un produit de substitution pour les toxicomanes, est devenue un produit d'addiction. Actuellement, l'honorable ministre de la Santé lui-même l'a affirmé récemment, environ 8 000 personnes sont sous traitement de la méthadone. Certains patients dénoncent les conditions de distribution difficiles, notamment dans les postes de police, et plaident pour une décentralisation vers des centres de santé. D'autres estiment que le traitement ne fonctionne pas comme prévu et qu'il faudrait revoir le protocole. De plus, avec plus de 65 000 consommateurs de drogue injectables et non injectables recensés, seuls 8 000 bénéficient de la méthadone, ce qui met en lumière un manque de ressources pour répondre aux besoins. Le programme aide certains à stabiliser leur consommation, mais son efficacité est entravée par des problèmes logistiques et sociaux, à tel point que des patients sont toujours sous traitement après plusieurs années, voire 10 ans ou plus. Je souhaite donc, Madame la Présidente, que l'Agence de contrôle et le ministère de la Santé se penchera sur le problème et prendra en considération des alternatives, si besoin est, à la méthadone, comme la buprenorphine et la naltrexone. La buprenorphine réduit les symptômes de manque et a un risque de dépendance plus faible, alors que la naltrexone empêche toute sensation d'euphorie en cas de rechute. Je note également que même si le projet de loi prend en considération la corrélation entre drogue et le VIH et SIDA, dans le but de minimiser la transmission du VIH et de l'hépatite C, il reste néanmoins centré sur la répression et le contrôle du trafic. Il faudra donc une approche de réduction des risques, inspirée des modèles comme celui, encore une fois, je le cite, du Portugal. L'absence de mention explicite de la décriminalisation ou de la dépénalisation pourrait limiter l'accès aux soins pour les consommateurs de drogue, freinant ainsi les efforts de prévention du VIH-Sida. Madame la Présidente, je me pose également la question de savoir quel sera désormais le rôle du National Drug Secretariat et du National AIDS Secretariat avec l'entrée en vigueur de la National Agency for Drug Control Act. Ce serait bien si le Premier ministre pourrait nous en dire davantage lors de son summing up. Madame la Présidente, pour revenir au National Agency for Drug Control Bill, je relève des points d'attention que le gouvernement ne doit pas ignorer. Donner trop de pouvoir à une seule agence sans mécanisme de contrôle fort peut mener à des dérives bureaucratiques ou à des lenteurs administratives. Il en est de même sur les moyens réels dont disposera l'agence. Aura-t-elle les moyens humains, financiers et techniques pour remplir sa mission? Le projet de loi ne donne pas de détails concrets sur le budget, ce qui est compréhensible probablement, ni sur la formation du personnel ou les outils de suivi. Plusieurs aspects, à mon avis, doivent être améliorés pour rendre ce projet de loi plus complet et plus conforme aux attentes modernes. Comme l'ambiguïté sur les mesures de réduction des risques dans les sections 6F et 6G du projet de loi, ces clauses ne définissent pas clairement les pratiques de réduction de risques acceptables, comme l'échange de seringues ou les sites de consommation supervisés. Cela pourrait entraîner une mise en œuvre incohérente à travers le pays. De même, Madame la Présidente, le projet ne mentionne pas explicitement les droits fondamentaux des personnes qui consomment des drogues, tels que le droit à la santé, la non-discrimination et la protection de la vie privée. Il est donc crucial d'inclure ces protections pour garantir que les services soient éthiques et respectueux des droits des usagers. Si on s'arrête aussi à la section 8, bien que la société civile soit représentée dans le conseil d'administration, le projet ne précise pas comment ces représentants seront choisis, seront sélectionnés, ni leur influence réelle sur les décisions de l'agence. Par ailleurs, la section 16 du projet de loi établit un fonds de contrôle des drogues. Mais il manque, à mon avis, des détails sur les sources de financement, les critères d'allocation et les mécanismes de surveillance de ce fonds. Il faut également faire attention, Madame la Présidente, que certaines ONG, très actives sur le terrain depuis des années, ne soient pas marginalisées. Je propose donc, Madame la Présidente, un renforcement de la prévention dans les écoles et les quartiers sensibles. Il faut tout un programme éducatif, dès le primaire, sur les risques liés aux drogues adaptés à l'âge. Les collèges devraient être dotés de clubs anti-drogue, encadrés par des jeunes leaders formés. Les ONG et éducateurs devront animer des ateliers réguliers dans les zones à risque. Des centres devront être accessibles dans chaque région de l'île avec un accompagnement médical, psychologique et social. Il est donc important de déstigmatiser l'usager, former la police, les juges, les médias et dans la foulée une formation obligatoire pour la police sur les nouvelles approches centrées sur l'accompagnement plutôt que la répression, mais également encourager des juges à recourir à des peines alternatives comme les thérapies et les travaux d'intérêt général pour les consommateurs. Mais pas de pitié pour les trafiquants. Ce projet, Madame la Présidente, suscite de l'espoir, mais aussi des interrogations. Autant que j'accueille favorablement, autant je vais répéter ce que j'avais annoncé lors de mon intervention sur le discours-programme. Il nous faut des moyens illimités en termes de ressources humaines, de technologies modernes et de l'approche à adopter pour mener à bien la lutte contre des trafiquants qui pullulent le pays et tuent notre jeunesse avec leur poison synthétique, en faisant preuve d'ingéniosité et sans doute avec la complicité, malheureusement, de certaines brebis galeuses au sein de la force policière. Madame la Présidente, les discours et les mises en garde ne servent malheureusement pas comme effet dissuasif. Nous voyons tous les jours des chauffeurs sous l'effet de drogue, inconscients dans leur véhicule, qui causent des accidents. Un jeune a été trouvé en possession de drogue dans une école primaire. Des jeunes collégiens ont été surpris en train de sniffer, d'autres avant moi l'ont dit, du déodorant et d'autres produits, et j'en passe. Le Premier ministre a révélé récemment à la Chambre que la quantité de drogue saisie de novembre 2024 à mars de cette année s'élève à plus d'1 milliard de roupies. Ce chiffre, Madame la Présidente, peut paraître énorme, mais il indique aussi que les trafiquants ne reculent devant rien. Ils font même davantage appel à des ressortissants étrangers, et surtout d'Europe, pour faire entrer de la drogue dans le pays. Et dans tout cela, Madame la Présidente, il y a l'épineux problème des drogues synthétiques. On en fabrique dans les laboratoires clandestins, on en trouve sous toutes ses formes, facilement accessibles aux petits comme aux grands, et plus prisé car à prix abordable pour toutes les bourses. Nous sommes témoins au quotidien de la zombinisation de nos jeunes, des dégâts causés à la santé mentale des jeunes consommateurs et avec une recrudescence des cas de violence physique et sexuelle. Et cela s'est répandu dans villes et villages, n'épargnant aucune couche sociale. En somme, Madame la Présidente, je soutiens ce projet de loi, mais pas de façon aveugle. Je le soutiens avec exigence, car la lutte contre la drogue mérite mieux que des intentions. Elle mérite des résultats. Donc, approuvons ce texte. Je termine. Veillons à l'accompagner, à le surveiller, à l'ajuster, pour qu'il ne devienne pas une énième réforme qui meurt sur papier, mais bien un levier de transformation réelle pour notre jeunesse, nos familles et notre pays. Je vous remercie.
Yes, Honourable Member, you mentioned a referendum. I stand under the correction of the Attorney General. Of course, we don't have yet a method of referendum, even if the word exists in our Constitution. You agree, yes, Honourable Attorney General? But it's a good thing to bear this in mind. Now I have Honourable Narsinger.
Thank you, Madam Speaker, for giving me the floor. Thank you, Madam Speaker, for giving me the floor. Drug trafficking and drug addiction are among the most serious scourges affecting our society. Madam the Speaker, it is very unfortunate that at a time when we are discussing about this important bill, we see that the two members of the opposition are not present. And this is very, very unfortunate. We criticized in the opposition for nearly 10 years. And we also made it very clear in our government program that we will tackle this scourge of society in the most frontal and steadfast manner. The present bill, Madam Speaker, is a testimony of our commitment to crack down on drugs. we do not only brag, but we must act. Our Prime Minister and Deputy Prime Minister mean business, unlike others in the previous regime. The bill marks a radical departure from previous practices. I will highlight the marked differences between NATRESA and the present National Agency for Drug Control. The previous regime was the champion of rhetoric. They were saying, "Vous cassez les reins, mafia la drogue." They mentioned that a couple of times. Instead, we have seen an unprecedented surge of drug trafficking and drug consumption during the reign of MSM. The series of unsolved scandals are still vivid in our mind. A number of speakers before me mentioned that. Tractopelle, gas cylinders, in nature, Wakashio, the Navin Krishna, who was on the run, on Kaval. It is true that we cannot crack down completely on drug. Let us not be demagogical. In my own constituency, we are witnessing the damage being done by this pernicious scourge. But it is a legacy of the previous regime. I listened carefully to what the leader of the opposition has been saying. We have seen the deaths of 2 young people by overdose in my own constituency. Madame Speaker, il ne faut pas se voiler la face. It is also opposite, Madam Speaker, to analyze the status of drug in 2 leading reports. Let us not forget the famous Ro report and Lam Shangming report. One was in 1987, and another one was in 2018. And around 1987, heroin and brown sugar were the fashionable drugs and the craze at that time. And also, at that point in time, we witnessed the slow creeping of Subutex, whereas today it is synthetic drug, even more dangerous. Now the drug traffickers are targeting more and more the poor, as we have seen the surge in the prices of cannabis. Both reports at that point in time pointed out the involvement of some politicians and the close circles of politicians. Both reports put on record the corruption at the level of the police, especially those who were supposedly to be trustees and guardians of the system. Justice Lam Shangling mentioned about the need to dismantle or to restructure ADSU. Have we done it up to now? Today we have a very competent and dedicated Commissioner of Police. But we must also address this recommendation regarding the restructuring of ADSU. I still have I have to confess, I still have very bad echoes regarding the functioning of ADSU. Therefore, it must not be mere restructuring, but also a careful selection of competent officers. More importantly, we need men of integrity. Integrity is of essence. Unfortunately, integrity is becoming more and more a rare commodity in our country. The Roe report explained the importance of strong political will. Yesterday, we did not have it, but today we have this strong political will. This is the marked difference, Madam Speaker. Resolving the drug scourge is not only a question of cracking down and inflicting punishment. It is also important to address the issue of prevention, treatment and rehabilitation, and coordination and research. Decisions on such an important issue cannot be capricious according to the whims and fancies of a Maximo leader as it used to be. Strategic decisions must also be backed on data, figures, and scientific information. Now, for the first time, we are witnessing such high-level engagement. The new legislation, by virtue of Section 3, set up a National Drug Control Commission. Who are the protagonists? No more than the Prime Minister, the Deputy Prime Minister, along with the Minister of Health, the Attorney General, and other ministers. And it is sad to note that the leader of the opposition was criticizing such sort of nomination. It seems that the leader of the opposition does not understand the basic principle of separation of powers. In all institutions, this is part of the executive. In all institutions, we have the political dimension and the administrative dimension. So it is unfortunate that the leader of the opposition has not understood the basic. It may also include, and this is a very good point, the Chief Commissioner of Road Works. We have not forgotten road works. We know the commitment of the PM and the DPM, and also the commitment of the Minister of Health, Mr. Anil Bechu, and the commitment of the Attorney General. We have no doubt that the political will is now a reality. It is, in fact, the NDC Commission which will set national objectives and goals. And in fact, it is very important to have a vision because we cannot afford to run without a sense of direction. Overall coordination at the highest level is critical, and this will be ensured by the Commission. There will be also, Madam Speaker, a real-time monitoring system, RTM, and publication of an analytic bulletin on a quarterly basis. Really impressive. Now, coming to the National Agency for Drug Control, it is important at this juncture to compare the defunct NATRESA with the new National Agency for Drug Control. As you know, NATRESA was focused on treatment and rehabilitation, whereas this new National Agency for Drug Control adopts, and this is important to put on record, a holistic and integrated approach which did not exist under NATRESA. Its mandate goes beyond treatment to include, very important to note, prevention, control, enforcement, policy coordination, very important, and data management. Such approach aligns itself on international best practices. It is a more balanced approach between public health, law enforcement, and like NATRESA, which operated under the Ministry of Health, the new institution will be more autonomous, very important for it to be autonomous, and at the same time, it will be a better coordinated agency. There is also now clear, very important to note this, interministerial cooperation. It ropes now the PMO, the DPMO, the Health Ministry, Justice, Education. So what we are doing, there is a multi-sectoral approach to tackle the drug scourge. So this inter-agency model reflects the framework of the UN ODC, that is the United Nations Office on Drugs and Crime. And so it lays a lot of emphasis on human rights also and public health. So I consider it to be a paradigm shift. It moves away from a purely punitive model to a more holistic one. Now the bill includes explicit policies on harm reduction strategies, access to evidence-based treatment. It also caters for vulnerable groups such as women, children, and people with mental problems. There is more emphasis on voluntary treatment and to reduce criminalization and drug, usually for small consumers. Madam Speaker, NATRESA was a single agency, and it could be sensed that the agency was overstressed at times, and it could not deliver. Whereas the new agency will now comprise multiple divisions, very important. One is helped on policy, and another one on research and strategy, another one on treatment and rehabilitation, yet another one on prevention and public awareness, especially addressing HIV and AIDS. So each unit will be spearheaded by a coordinator, and coordination and cross-fertilization of knowledge will be of essence. Now I will now focus on an important role of the research unit. As a researcher myself and an academic, I know the importance of research. And robust research data is fundamental to develop an evidence-based drug policy. In fact, research can provide critical insights into the complex dynamics of drug abuse. Madam Speaker, Decisions cannot be capricious and subjective. Regular surveys are important, especially school-based surveys. Treatment based on data is essential, for example, to know the types of drugs being used, demographics of clients, and reasons for seeking help. Socioeconomic impact data is also critical, Madam Speaker. Costs associated with drug use versus costs and benefits of different interventions must be made. Social impact studies are critical to formulate informed decisions. Both qualitative and quantitative research can show the consequences on drug use on families, communities, and public health. We also know the impact of drug on marginalized communities or regions. The research unit must be capable to evaluate programs. Rigorous evaluation is required. So, Madam Speaker, we are today having an important bill. We know that this government means business. We know that the Prime Minister means business. We know that the Deputy Prime Minister means business. We know that all members of this Parliament, possibly except the two, we mean business. We want to crack down on drug, and we are going to do it. We must do it. Because the future generation will not excuse us if we cannot tackle this very, very important scourge in our society. Thank you.
Thank you very much. Mr. Etwaria, keep an eye on the time if you can, please.
I will. Madame la Présidente, je suis particulièrement heureux qu'aucun des orateurs avant moi n'a affirmé que le problème de la drogue est une fatalité et que nous devons vivre avec. Ce soir, je suis heureux de faire partie de ce gouvernement qui, après 5 mois aux affaires, présente un projet ambitieux de lutte contre le poison qui a déjà fait des milliers de morts et ruiné autant de familles. J'en remercie le Premier ministre, son enthousiasme et sa fermeté qu'on a vu ce matin sont tout à fait contagieux. Je remercie aussi le DPM. Je ne veux pas révéler la teneur des discussions que nous avons chaque semaine lors de nos réunions de bureau politique au MMM, mais je peux dire que le DPM nous a, semaine après semaine, témoigné d'une certaine impatience, mais beaucoup de volonté et la sincérité du gouvernement de foncer avec la National Agency for Drug Control Bill. Beaucoup a déjà été dit depuis tout à l'heure. Il ne me reste pas grand-chose à ajouter. Toutefois, Madame la Présidente, je vais pour ma part tenter de décortiquer l'aspect socio-économique de la consommation de la drogue. Ce phénomène concerne, selon des spécialistes, entre 20 000 et 30 000 personnes de tout âge, de toutes les religions et de toutes les régions. Je m'empresse d'ajouter que ce fléau, et je viens à mon point essentiel, que ce fléau est la pure conséquence et la manifestation de notre société qui roule à 2 vitesses. Il n'appartient pas à ce projet de loi ou à la loi ou l'institution qui sera créée au bout de régler le problème d'une société à 2 vitesses. Mais je le fais comme une piqûre de rappel, au fait, pour dire que aussi longtemps que le problème de la pauvreté ne sera pas vaincu d'une certaine manière, d'une certaine hauteur, le problème de la drogue risque de perdurer. Oui, malheureusement, la drogue, c'est une affaire des riches et des pauvres, de toutes les façons. Je ne vais pas parler des trafiquants qui font d'immenses fortunes sur le dos des consommateurs, des malheureux passeurs des mules ou des petits revendeurs qui se font exploiter par les grands trafiquants, ou encore des États mal ou sous-équipés qui ne font pas le poids face aux moyens gigantesques des trafiquants. Dès lors, il est évident que c'est la population à bas revenus qui, vivant dans des quartiers défavorisés, qui sont les premières victimes. Des études avancent que 95% des consommateurs de drogue viennent des quartiers défavorisés. La CAM frappe là où les infrastructures sociales sont absentes, où les jeunes sont délaissés à eux-mêmes et où l'horizon paraît bouché. Il y a une corrélation directe entre le niveau économique des gens, des personnes, des consommateurs et la consommation de la drogue. Diverses études à Maurice, mais aussi à l'étranger, concluent que les enfants des familles démunies sont 20 fois plus susceptibles de se droguer que le gosse des familles aisées et de niveau éducatif plus élevé. La drogue est certes consommée de plus en plus par des personnes aisées, mais la drogue est plus dangereuse pour les personnes en situation de précarité. Ces problèmes lient et nous ramènent aussi à des difficultés d'accès aux soins, à la prévention. Le pauvre meurt plus que les riches d'intoxication. Il entre dans un cycle infernal qui le mène au désarroi, à la violence, à la prostitution. Toute la population défavorisée ne se shoote pas au synthétique, mais sa précarité la rend vulnérable. Cette population pauvre a recours aux drogues synthétiques, moins chères, facilement accessibles, très addictives et dangereuses. Les riches, ils sniffent de la cocaïne, 3000 roupies la ligne, dans le confort et l'intimité de leur salon. La bonne nouvelle par rapport à ce projet de loi est ce projet de loi qui fait débat ici et qu'il fait une grande place à la prévention. La prévention, ici, dans ce projet de loi, constitue un axe fort contre la consommation. Il s'agit de réduire la demande par les biais des campagnes d'information, des sensibilisations que représentent les dangers, Mais attention, la sensibilisation qui doit bien sûr commencer à la maison, à l'école, ne suffit pas à elle seule. Je souhaite que la future National Agency for Drug Control mette en place un mécanisme pour détecter les victimes de façon précoce avant qu'il ne soit trop tard. J'avance l'idée, Madame la Présidente, de former une armée des travailleurs sociaux de proximité. On a déjà parlé de la police de proximité, je parle d'une armée des travailleurs sociaux de proximité qui pourront prévenir la descente aux enfers. Le fossé entre riches et pauvres est aussi manifeste en matière de réhabilitation, qui est l'autre axe fort de ce projet de loi. Ce n'est pas donné à tout le monde de se payer une cure d'intoxication. Des riches, gosses ou adultes, s'en vont discrètement en Inde, en Suisse, dans des cliniques spécialisées et se payent des traitements coûteux. Guide de la population défavorisée. Où va-t-elle se soigner pour autant qu'elle ait été convaincue de le faire? À l'heure actuelle, l'État ne peut prendre en charge que quelques 200 personnes, au Brand-Séquard, à Montaillon ou encore à Maillebourg. Les organisations non gouvernementales, l'Église en particulier, font un travail immense, mais tout cela n'est pas suffisant, vu l'ampleur du mal. Madame la Présidente, c'est réjouissant de noter que les pères fondateurs de la National Agency for Drug Control accordent une place prépondérante à la réhabilitation de ceux qui sont tombés dans le piège de la drogue. Avec plus de moyens, avec un encadrement mieux fourni et plus engagé, la nouvelle institution viendra aussi combler le fossé entre les nantis et les moins nantis en matière de réhabilitation. Je ne vais pas rentrer dans le sujet du trafic de la drogue qui est largement commenté ici. Je vais conclure, Madame la Présidente. Nous pouvons et nous devons déclarer la guerre à la drogue. Cette institution est un instrument à le faire. Nous gagnerons cette guerre seulement, nous gagnerons la guerre contre la drogue seulement si nous remportons aussi la drogue contre la pauvreté, contre le manque de perspectives pour nos jeunes et les moins jeunes, mais surtout dans les milieux défavorisés. Merci, Madame la Présidente.
Je vous remercie. Honorable Sibel.
Thank you, Madam the Speaker. We have reached a critical situation with the drug problem in Mauritius, which the previous government has failed to tackle. Madam the Speaker, the introduction of the National Agency for Drug Control Bill is a concrete step for fight against illegal drugs, and it is in the right direction to restore the trust of the nation. We have an obligation to protect our children, to protect our youth and the people of Mauritius from the risk and harm of drugs. This government was elected on a promise of change to pledge and deliver in creating a new Mauritius in the 21st century, where we now see changes happening step by step with a view to make Mauritius a better place to live. Madam the Speaker, there is no doubt that this bill lays down strong foundations to tackle drug problem together with a fresh and long-term approach, not only with the establishment of the National Agency for Drug Control under Section 5 of the bill as the apex body, but also with the establishment of the National Drug Control Commission, where, Madam the Speaker, we see the voluntariness of this government going that extra mile, and where the Prime Minister himself is standing as the chairperson of the Commission and the Deputy Prime Minister as the Vice Chairperson. This shows the seriousness of the drug problem and the firm commitment of both leaders to deal with the issues. Madam the Speaker, this bill empowers the Commission to set national objectives in the fight for the scourge of drugs and further empowers the Commission independently to oversee all drug control activities in Mauritius and evaluate the implementation of the National Drug Control Master Plan. The main objectives of the National Agency for Drug Control shall be to emphasize on the demand reduction of the drugs through the prevention, treatment, and rehabilitation of persons who use drugs and the social integration in the society, and at the same time, minimizing the negative health and social consequences. Madam the Speaker, Amnesty International says that criminalizing drugs does not decrease their use or supply. Instead, it drives the trade underground, increases the harm in using drugs, and fuels organized crimes, corruption, and violence. Evidence from several regions around the world shows that the war on drugs fails to decrease the use and availability of drugs, despite severe law enforcement with death penalty for drug offenses in Malaysia, China, and Singapore, mass incarceration in the United States of America, and torture in Mexico for drug offenses unless tackled otherwise. This is how we see the former President of the United States, Barack Obama, adopted a different approach and announced in a press conference in Atlanta to tackle drug problem with a demand reduction, where he said, the most important thing to do is to reduce demand, and the only way to do that is to provide treatment. And he went on to say, Madam the Speaker, it is to be seen mainly as a public health problem, and hence proposed during his mandate a drug control budget, where he tried to walk on the steps of the former United States President Jimmy Carter, who had previously pledged to spend more on treatment and prevention than law enforcement. However, Madam the Speaker, the White House officials adopted a balancing exercise to split the financial budget of that year for public health side and law enforcement side to a 50-50 approach to combat the drug problem. Perhaps a similar approach could be exercised with more efficiency for Mauritius with better results. Madam the Speaker, the bill empowers the National Agency for Drug Control under Section 8 of the Act to facilitate the implementation of the National Drug Control Master Plan and operate in accordance with the international standards and guidelines of the United Nations Office on Drugs and Crime, and further conduct research to determine the magnitude of the social and economic impact of the drug use in Mauritius. Madam the Speaker, the bill further makes provision through the Treatment and Rehabilitation Division of the National Agency for Drug Control to work in collaboration with the Ministry of Health, the NGOs, and mobilize resources locally with the private sector for vocational training and work placement programs for persons recovering from drug disorders. The bill further empowers the agency through its Prevention and Public Awareness Division to lead national campaign, sensitize people at large, and conduct local awareness through workshops, through community events, and promote awareness of the risks involved in consuming drugs. The bill also provides the agency to work along with the Ministry of Education to implement drug use prevention curriculum, if possible, in all educational institutions by emphasizing in promoting sports and life skill training program to keep youth engaged in activities. Madam the Speaker, the bill makes provision for the National Agency for Drug Control through its Supply, Reduction and Coordination Division to emphasize on enforcement of drug control laws and facilitate cooperation with the police, with the customs, and with the Mauritius revenue authorities. As rightly emphasized in our government program, we shall work to enhance the regional maritime security to combat illegal drug trafficking on the high seas, and at the same time, increase our surveillance capacity with the help of regional member states. The bill rightly makes provision for a confidential hotline access for individuals and families seeking help for reporting drug use and trafficking problems. Madam the Speaker, this bill introduces the most independent institution to tackle the vicious cycle of drugs in our society that has wrecked several lives, broken families, and threatened several communities. Madam the Speaker, we have pledged to protect our community and ensure that decent opportunities are available, and we cannot conclusively achieve this if we do not take control of the fight against drugs. We shall aim to continue tackling inequalities through the largest program to get more people at work and bring reform for a better welfare state with a better education system, health services, justice, and for a better economy. We have inherited dire economic situations from the previous government. Hence, we need to improve the efficiency and coordination to achieve better results. There is a need to ensure that this strategy is translated into concrete action, as there is a real chance of reducing drug problems and creating a healthier society. Before I conclude, Madam the Speaker, one should know that the drug problem is not in isolation. It is often tied up with other social and family problems. It is a serious threat to health. Today, illegal drugs are widely available than ever, exposing a serious threat to our children, serious threat to the community and people at large, which may lead to drug-related crime. Thus, the fight for drugs is not just a matter for the government. It is also a matter for the teachers at school, for the parents at home, for the NGOs in the community at large, and for everyone who cares for the future of our society. Madam the Speaker, this is an ongoing fight. We owe it to our children, we owe it to our family and friends, and we owe it to our motherland. The bill comes from a truly imaginative solution where the compliance and implementation will have positive impact to overcome the current drug problem in Mauritius and save lives of our people they deserve. We have a duty to stand together with a unified approach to face drug problems, as stated by the Prime Minister earlier. Madam the Speaker, I take this opportunity to congratulate the Honorable Attorney General for coming forward with this legislation and his team for working on this bill with clarity, and further convey my sincere gratitude and deep appreciation to the Honorable Prime Minister and the Deputy Prime Minister for their unwavering commitment to join hands together and do whatever it takes to combat the current drug problem and make Mauritius once again a better place to live. Madam the Speaker, with these words, I commend the bill to the House.
Honourable Edouard, you're the last speaker, I think.
Thank you, Madam Speaker.
Keep an eye on the time. Huh?
I will be very brief, I suppose. This is a wonderful piece of legislation from a government with a clear vision to address a drug problem in the Republic of Mauritius. This bill is most welcome. This bill translates a will and a promise, because on the campaign trail, we promised to take care of our fellow citizens. And with this bill, the Honorable Prime Minister is telling us it is time for action. And as you know, actions speak louder than words. This bill tolls the start of a fight, in a relentless battle to overcome this issue of drugs in the Republic. For my part, I will emphasize on Rodrigues and on Section 2B of this bill. That is, disrupting the entry, production, and availability of drugs. C'est malheureux quand même qu'à Rodrigue, il y a une polémique malvenue et stérile sur la nécessité de porter une attention spéciale à ce problème de drogue. Parce que la croyance, c'est qu'à Rodrigue, le problème n'est pas aussi alarmant qu'à Maurice. C'est vrai que nous avons un problème avec les drogues douces comme l'alcool et la cigarette, qu'il faut aussi une attention spéciale. Mais, avec votre permission, Madame la Présidente, je vais citer les findings of a survey from 2022. These findings are important. 12.4% of the population of Rodrigues aged between 15 and 64 years have ever used drugs. 2.3% of the population aged between 15 and 64 years are currently using drugs. 2.7% of the youth of Rodrigues aged between 20 and 24 years are currently using drugs. 2.2% of the youth of Rodrigues aged between 5 and 19 years are currently using drugs. 1.3% of the students of Rodrigues are currently using drugs. There are about 300 people that have ever used heroin, 100 ever used synthetic drugs. And among the current users, and this I think is very important for us to pay special attention, 30.8% of current drug users admitted it is easy or very easy to access drugs for consumption in Rodrigues. And 26.5% of the residents of Rodrigues believe that there are heroin in Rodrigues, and 28.8% believe that synthetic drug is a trendy drug in Rodrigues. And it is important that we pay attention to this. And also, among those who have ever consumed drugs, 62.7% had their first drug experience in Rodrigues itself and not outside Rodrigues. So, for me, it is alarming. The situation of drugs is alarming because though it's only 1 gram, it's 1 gram de trop. So we must fight to disrupt the entry of drugs, especially synthetic drugs in Rodrigues. And some also say that there is also production of synthetic drug in Rodrigues. We are happy that Section 9.2.0 makes provision for Rodrigues to be represented on the Drug Control Board. But in Section 3.3, you are seeing again, as I said the other time, that the Chief Commissioner may attend meetings of the National Drug Control Commission. We have had a bad experience with this may attend. We have had bad experience in the Rodrigues Regional Act, where it is said the Chief Commissioner may attend cabinet meetings, and it never happened. We ask ourselves why, as head of Rodrigues, the Chief Commissioner is not a member of the National Drug Control Commission. I most humbly beg the Honorable Prime Minister to include the Chief Commissioner in Section 3.2 so that he become a member of the National Drug Control Commission. And now I come to the visualization of the control of drugs in Rodrigues. I imagine a handful of police officers in Rodrigues who have to look after the port, the airport, and cruising vessels who comes very near the reefs of Rodrigues. And I heard before other colleagues were talking about Wakasho and what may have happened. And we also in Rodrigues were asking ourselves, why do these large vessels cruise so near Rodrigues? Why do they cruise so near? So we have to pay attention to this as well. And in this endeavor to control drugs in Rodrigues, we must think that Rodrigues is not a district as the other districts in Mauritius. Rodrigues is an island, and that's why I'm saying a handful of police officers is not sufficient to address this drug control problem. And we know that the Lam Shanglin report on drugs have pertinent recommendations for Rodrigues. And there is need to invest in Rodrigues in equipment necessary for the control of the entry of drugs in Rodrigues. And there is need in Rodrigues to have systematic scanning of all containers reaching Rodrigues, because now as it is, containers are leaving the port area unchecked. So there is a need to have systematic scanning of all containers leaving the port area. This is the wish of the police officers who are responsible for the control of drugs in Rodrigues. And also at the airport, there must be systematic scanning of all luggage in the airport. So we see that it's not that alarming, I concede, but we must pay special attention to disrupt the entry, the production, and the availability of drugs in Rodrigues. And I recall my late godfather, who very often used the term cunning like a fox. And we know that the dealers are cunning like a fox, and there are many ways to just get away with that trafficking. And we must also pay attention in road rage, as we all see and we all know that there is that thing of money laundering. And we must see through what is happening, the different activities, cultural activities, leisure activities, where it may be opportunity for money laundering. So this is a wonderful piece of legislation, and I thank the Honorable Prime Minister for this, and he's calling us for action, and I'm happy to support this bill. Thank you very much.
Honourable Deputy Prime Minister.
Madam Speaker, with your permission, I move for adjournment of the debates.
Thank you. It's seconded. Mr. Bhagwan, you second. The question is that the debate be now adjourned. Those in favour say aye, those against say no. Aye. The ayes have it. Now, I think it's the Prime Minister.
Yeah, Madam Speaker, I beg to move for the adjournment of the House to Tuesday, the 22nd of April at 11:30.
The House stands adjourned. Thank you, everybody. Thank you for having stayed for almost 11 hours. And thank the staff from everywhere which have been with us from this morning.